We're back. Let's go to California and welcome Kim to the show. Hi, Kim.
Hi, Cindy. Hi, Dr. Becker.
Hi.
Thank you for joining us, Kim. How can we help you?
Thank you for having me. I was calling today to ask regarding arthritis and fatigue.
Okay.
And also, I've been having a lot of pain in my upper right side. I've had hepatitis C for some time. I'm an XIV user. I have 17 years clean.
Good for you, girl. Good for you.
And I've been experiencing a lot of right pain and right underneath my rib cage lately.
Yes.
And I was thinking it might be my liver.
Well, yeah, that's where you would experience liver discomfort. So you've been tested. You know you have Hep C?
Yes, I do.
Is it in the chronic active phase?
No, it's actually been inactive for years.
Okay. So we don't know if you have cirrhosis or not? Because, see, not everyone with Hep C goes on to cirrhosis.
Right, I do not know.
Do not know? Well, I think that's real important. Perhaps another visit with the doctor to check to see where you are with the cirrhosis. But in any event, even if we are to cirrhosis, it's important that we take the steps to do what we can to preserve our health and to make our situation as best as it can possibly be. And, you know, that's not just to make us better. That's being a good steward. You know, it's our responsibility to take care of that. So, you know, I think that's good advice. Now, we know now that milk thistle absolutely, statistically, helps people with hepatitis C. We have multiple double-blind studies now that confirm this. The naysayers and doubters have been saying, but you don't have evidence on that. We've got it now, and we've had it for some time. Let's get our heads out of the sand. Milk thistle helps hepatitis C. Better quality of life, better liver enzymes. We can go on with this, okay? So milk thistle is a very important part of your program, and I want to send you some. Alpha-lipoic acid is phenomenal for cirrhosis. Let's just assume you have that. Well, that's what we're trying to prevent anyway. Either way, we're gonna take care of that. Alpha-lipoic acid, and I would take at least 600 milligrams twice a day. You know, twice a day. Alpha-lipoic acid is such a strong antioxidant. It helps the liver do its job. You know, one of the main jobs of the liver is to process glucose, okay? And alpha-lipoic acid helps the liver do that. It's one of its fundamental ways why it helps so many different conditions. And here's an area that most physicians have no inkling of. When we have a dysbiotic bowel flora, when we have yeast and altered bowel flora, all the blood from the intestinal tract goes directly to the liver, okay? That's normal. It's supposed to do that. All the nutrients from food go directly to the liver for processing. But when you're dysbiotic, when you have chronic yeast and altered bowel flora, the toxins produced by these organisms go directly to the liver and cause troubles. The liver is unable to process those. We have reported case studies of probiotics reversing hepatic coma due to cirrhosis. Okay? That is amazing. When people wake up from a coma just because they put probiotics through a nasogastric tube down in the intestinal tract, that gets your attention. Actually reversing hepatic coma, that's amazing. So we want to restore normal bowel flora. We want to treat the yeast. We want to line that gut flora, and we do that with agents like oil of oregano. The medicinal mushrooms would be excellent for you, cordyceps, because they help liver function as well. And don't forget your vitamin D. Now, Kim, you live in sunny California, but you know, we don't get out in the sun like we used to, and we don't work on the farm like we used to. So the studies say you're probably low in vitamin D, and that's something that is really important for a liver patient to know for sure, because the liver processes vitamin D, and I'd hate to overload you with vitamin D. So you may only require 2,000 units a day, whereas the next person would require 4. So I want to send you some vitamin D, but I strongly recommend for you to get your vitamin D level checked. You can do that when they're checking on the cirrhosis status. See, that'd be a good idea to do that. Let's see what else. A little noni juice, okay, and a little ginkgo. We have a new study now that shows ginkgo helps to prevent the progression of hepatitis C into liver cancer. It is such a powerful anti-inflammatory, it can actually help prevent cancer. Wow, that's amazing. So all of this is adding up to a plan that can make a big difference for you. Did you notice she complained of fatigue? This is the most consistent symptom of the liver patient. I'm just washed out. I don't have the energy. And we got to get that back. It's a quality of life issue, and this is how you do it. Foundations for Healing is coming your way, dear. Hang in there. Get your medical checks done. Your supplements are on the way. Better liver health is coming your way as well. Good. Smoothies unlock the nutrients. Release them so that you can absorb all that you need to get through the day. Boy, I need it too, just like you. Thank you for joining us, folks. Hope to see you tomorrow. Bye-bye, everyone.
Thank you. Bye-bye.